I see this pattern almost every day in my practice, and it still surprises me how often it goes unnoticed. A patient comes in for a routine checkup. Their blood pressure reads higher than normal, and when I start asking questions, one detail emerges consistently. They're not sleeping well. Not just one bad night here and there, but weeks or months of fragmented, restless sleep that they've learned to live with. What catches my attention isn't just the elevated numbers on the blood pressure monitor. It's the way patients describe their nights, tossing and turning, waking up multiple times, feeling like their mind won't shut off. They mention it almost as an afterthought, as if poor sleep is just part of getting older or dealing with life stresses. Some tell me they wake up around 2 or 3 a.m. and can't get back to sleep for hours. Others describe feeling physically tired but mentally wired when their head hits the pillow. The descriptions vary, but the underlying pattern remains remarkably consistent. I've noticed that many people don't connect these sleep disruptions to their cardiovascular health. They might meticulously track their daily sodium intake or maintain a regular exercise schedule, yet completely overlook the fact that they haven't had a solid night's sleep in months. This disconnect often becomes apparent when I ask them to keep a simple sleep diary alongside their blood pressure log for a few weeks. What strikes me most is how they've normalized this disruption. They'll say things like, "I'm just not a good sleeper," as if this explains away what might be a significant health factor. But from a clinical perspective, this connection between disrupted sleep and rising blood pressure represents one of the most under-recognized cycles in cardiovascular health. The relationship works both ways, which makes it particularly insidious. Poor sleep can drive blood pressure up, and elevated blood pressure can make quality sleep even more elusive. It's worth paying attention to how often this comes up when patients start tracking both their sleep patterns and their blood pressure readings over time. In general medical practice, we've known for decades that sleep and cardiovascular health are linked, but the mechanisms behind this connection continue to reveal themselves in ways that challenge some of our earlier assumptions. When someone doesn't get adequate, restorative sleep, their body maintains higher levels of stress hormones like cortisol and adrenaline. These hormones don't just affect mood and energy. They directly impact how blood vessels function and how the heart responds to daily demands. The physiological changes that occur during poor sleep are more extensive than many people realize. The sympathetic nervous system, which controls our fight or flight response, becomes hyperactivated. This means blood vessels constrict more readily, heart rate variability decreases, and the body's natural inflammatory responses become heightened. It's not just about feeling tired. The entire cardiovascular system operates differently when sleep quality is compromised. During normal, healthy sleep, blood pressure naturally dips by about 10 to 20% compared to daytime levels. This nocturnal dip gives the cardiovascular system a chance to reset and recover. The heart rate slows, blood vessels relax, and various repair processes take place that help maintain cardiovascular health. But when sleep is fragmented or insufficient, this protective mechanism gets disrupted. The blood vessels remain in a state of heightened tension, and over time, this can contribute to sustained hypertension even during waking hours. I've observed that people who lack this normal nocturnal dip in blood pressure, something we call non-dipping, often have more severe cardiovascular outcomes over time. They might not feel dramatically different day to day, but their cardiovascular system is working harder around the clock, never getting that crucial recovery period that proper sleep provides. What makes this particularly challenging is how sleep disruption can be so gradual that people adapt to it without realizing what's happening. Someone might start going to bed later due to work demands, or they begin waking up more frequently because of stress or physical discomfort. Initially, they might feel tired during the day, but the body has remarkable ways of compensating. They learn to function on less restorative sleep, and the blood pressure changes happen so gradually that they're not immediately noticeable. This gradual adaptation can be deceptive. I've had patients tell me they've always been fine on 5 hours of sleep, or that they don't need much sleep to function. But when we look at their blood pressure trends over months or years, or when they participate in sleep studies, we often see that their definition of functioning fine doesn't align with what their cardiovascular system is actually experiencing. There are different views on this, but many people believe that if they're getting 6 or 7 hours in bed, they're getting adequate sleep. The reality is more complex. It's not just about the total time spent in bed. It's about the quality and architecture of that sleep. Someone might spend 8 hours in bed, but only get 5 hours of truly restorative sleep because they're waking up frequently or spending too much time in lighter sleep stages. Sleep architecture refers to the different stages of sleep that cycle throughout the night. Deep sleep, REM sleep, and lighter transitional stages all serve different functions in cardiovascular recovery. When this architecture is disrupted, whether by sleep apnea, stress, medications, or environmental factors, the restorative benefits are diminished even if the total sleep time appears adequate. I've found that people often underestimate how much their sleep is actually fragmented. They might wake up briefly multiple times during the night, but not remember these awakenings the next morning. Or they might attribute frequent nighttime awakenings to external factors like needing to use the bathroom, without considering that underlying cardiovascular changes might be contributing to their restless sleep. The body often wakes us up when it's struggling with blood pressure regulation during the night. This misconception extends to how we think about treating elevated blood pressure. I often encounter patients who are surprised when I ask detailed questions about their sleep habits during a cardiovascular evaluation. They expect to discuss diet, exercise, family history, and stress levels, all important factors, but sleep often feels unrelated to them. Yet from a physiological standpoint, sleep quality can be as influential as any of these other factors in determining blood pressure patterns. The surprise in their faces when I explain this connection tells me how little this relationship is discussed in general health conversations. They might have spent years focusing on reducing sodium intake or increasing exercise, while largely ignoring the fact that they haven't had a consistently good night's sleep in months or years. The confusion deepens when people try to address sleep issues on their own. Some turn to alcohol, thinking it helps them fall asleep faster. While alcohol might make someone feel drowsy initially, it significantly disrupts sleep architecture later in the night, leading to more fragmented rest and potentially worsening the blood pressure connection. The sedative effect wears off after a few hours, often causing people to wake up in the middle of the night with their mind racing and their heart rate elevated. Others rely on caffeine to compensate for poor sleep during the day, which can then interfere with their ability to fall asleep that evening, perpetuating the cycle. What starts as one bad night becomes a pattern of poor sleep and increased caffeine consumption that can persist for weeks or months. The caffeine provides temporary alertness, but can also contribute to increased anxiety and elevated blood pressure during the day. Some people try various supplements or over-the-counter sleep aids without understanding how these might interact with their cardiovascular health or other medications they're taking. While some of these approaches might help with falling asleep, they don't necessarily address the underlying issues that are disrupting sleep quality or the connection to blood pressure regulation. Technology has added another layer of complexity to this relationship. Many people now have devices that track their sleep and blood pressure, providing more data than ever before. But this information can sometimes create more anxiety than clarity. Someone might become fixated on achieving perfect sleep metrics or worry excessively about slight variations in their blood pressure readings. This anxiety itself can contribute to both sleep difficulties and elevated blood pressure, creating a feedback loop that's challenging to break. The accuracy of these consumer devices is another consideration. While they can provide useful trends, they're not always precise enough to make specific medical decisions. This can lead to confusion when device readings don't align with clinical measurements. From a clinical perspective, the social and cultural factors surrounding sleep have changed dramatically over the past few decades. The expectation to be constantly available, the prevalence of screens in bedrooms, irregular work schedules, and the general acceleration of daily life have all impacted how people approach rest. This is something many people don't really think about when considering their cardiovascular health. When I evaluate someone with hypertension, I'm looking at their sleep patterns as seriously as I look at their diet or exercise habits. But this requires a different kind of conversation than the typical medical interview. People often underestimate their sleep disruption or normalize it because it's been gradual. They might not realize that waking up 3 times a night isn't normal, or that feeling unrefreshed despite spending adequate time in bed could be significant. Sleep disorders like obstructive sleep apnea can have a particularly strong connection to hypertension, but they often go undiagnosed for years. People with untreated sleep apnea might struggle with blood pressure control despite medication and lifestyle modifications simply because this underlying issue isn't being addressed. The challenge extends to treatment approaches as well. While there are effective medications for managing blood pressure, addressing the sleep component often requires behavioral and lifestyle modifications that take time to implement and even longer to show results. This can be frustrating for patients who are accustomed to more immediate medical interventions. In my experience, people who begin to understand this connection often become more motivated to address both issues simultaneously. They start to see sleep not as a luxury or something that happens automatically, but as an active component of their cardiovascular health. This shift in perspective can be more powerful than any single intervention. When someone starts tracking their sleep quality alongside their blood pressure readings, they often begin to notice patterns they hadn't seen before. They might realize that their blood pressure tends to be higher after nights of poor sleep, or that certain stressful periods affect both their rest and their cardiovascular readings. This awareness can be the first step toward making meaningful changes. One patient recently told me that after tracking both measures for a month, she could predict her morning blood pressure based on how she slept the night before. This kind of personal insight often motivates people more effectively than general health recommendations. They begin to see the immediate, measurable connection between their nightly rest and their daily cardiovascular health. However, it's important to approach this tracking mindfully. Some people become so focused on optimizing every aspect of their sleep that they create additional pressure and anxiety around bedtime. The goal is awareness and gradual improvement, not perfection in every sleep metric or blood pressure reading. I often remind patients that occasional poor nights are normal, and the focus should be on overall patterns rather than individual readings. But even with increased awareness, the relationship between sleep and blood pressure isn't always straightforward. Some people can improve their sleep habits significantly and still struggle with hypertension due to genetic factors, other medical conditions, or medications that affect sleep architecture. Others might see dramatic improvements in their blood pressure simply by addressing underlying sleep disorders they didn't know they had. Individual variations in how people respond to sleep interventions can be substantial. Factors like age, overall health status, stress levels, work schedules, and personal sleep needs all influence how quickly and dramatically someone might see changes in their blood pressure after improving their sleep quality. Some people notice differences within weeks, while others might need months of consistent sleep improvement before seeing meaningful changes in their cardiovascular readings. There are also underlying medical conditions that can affect both sleep and blood pressure simultaneously, making it difficult to determine which is driving which. Conditions like diabetes, kidney disease, thyroid disorders, or certain neurological conditions can impact both sleep quality and cardiovascular function. In these cases, addressing sleep alone might not be sufficient to normalize blood pressure, but it can still be an important component of overall management. The research in this area continues to evolve, and there are still aspects of this relationship that we don't fully understand. For instance, the optimal amount of sleep for cardiovascular health appears to vary among individuals, and the impact of sleep quality versus sleep duration is still being studied. Some recent studies suggest that sleeping too much might also be associated with cardiovascular risks, but the mechanisms behind this are less clear. Medication interactions add another layer of complexity. Some blood pressure medications can affect sleep quality, and some sleep aids can influence blood pressure. Finding the right balance when both issues need to be addressed simultaneously requires careful monitoring and often some trial and adjustment. These are questions that come up a lot in real life when people start paying attention to both their sleep and their blood pressure. The relationship isn't as simple as sleep better, lower blood pressure. Though for many people, improving sleep quality does contribute to better cardiovascular health overall. What I find particularly important is helping people understand that this connection doesn't necessarily mean they need to achieve perfect sleep to manage their blood pressure effectively. Rather, it's about recognizing sleep as one important factor among many and approaching both issues with realistic expectations and sustainable strategies. The goal isn't to create additional stress or anxiety around sleep, which can be counterproductive for both sleep quality and blood pressure control. Instead, It's about developing awareness of the connection and gradually implementing changes that feel manageable and sustainable over time. The conversation around sleep and hypertension continues to evolve as we learn more about how these systems interact. What remains clear is that dismissing sleep quality as unrelated to cardiovascular health overlooks a significant piece of the puzzle for many people dealing with elevated blood pressure. Understanding this connection, even with its complexities and individual variations, can open up additional pathways for improving overall cardiovascular health that might otherwise be overlooked.